And we're broadcasting live at Al Jalila Culture Center for Children at Unsa Came 3. Today is a beautiful day. Today's Thursday, December 19th, 2019. We've got the one and only amazing, incredible Dr. Mina Sharapim, pediatric dentist. Good morning. How are you doing, doctor?
Good morning, Saif. How are
Magic
you?
Phil, I can see you. Don't interrupt us, okay, Magic Phil? I can see you. All right, so Dr. Mina Sharapim. So today, what are we going to be talking about? What are we going to be covering today?
Today we'll be covering how to prepare your child for the dentist and what to expect in the first visit.
Oh, okay. Now this is something really interesting. So let's jump into the questions right now. So Dr. Mina Sharapim, like how to prepare your child to visit the dentist. Now this is like a commonly known question, right? Like everybody loves to ask you that question. So how do you prepare, like your child to visit the dentist?
So the rule is, if the child is his first time to visit the dentist in his life, it's just meet and greet. We do not do any procedures. The maximum procedure we can do is that we can have his checkup and his cleaning, just to introduce him to the dental surroundings.
Okay.
The second thing that when you want to tell the people, and please parents, do not be anxious. I want the parents themselves do not be anxious, because the kids feel their parents. If the parents are scared, they will automatically be scared.
Yes.
And please do not offer information to the kids.
Like what's going to happen,
Exactly.
what the doctor's going to inject you with and stuff like that.
And please do not use the couple of words. Injections, we are not allowed to use. That's the I word, I call it. That's the bad word.
Okay.
And we call it, instead of sleepy juice or the magic pill.
Magic portion or something like
Magic juice or something, or the
Okay.
sleeping juice. And do not use the word hurt or are you hurt? Are you in pain?
Oh, okay.
Oh, and
why shouldn't we use these kind of words whenever
we should not use it.
Why, doctor?
Because if the kid says pain, he will start to panic. If he hears the word pain, he will start to panic. Like, what's going on? Why I have pain?
The first thing that's gonna pop on his mind, he'll be like, okay, now I'm gonna cry.
Yes,
It's
exactly.
gonna hurt me so much.
Exactly, and then you don't know why the patient is crying. If he's crying from pain or he's crying from an anxiety.
Yes.
And that's why and that's why we say, please let the dentist do the job. Do not interfere. Let him do everything. And just remember, us as a pediatric dentist, 90% of the job is psychological. It's not dental.
Okay, all right, that's really good. So, Dr. Mina Sharapim, I want to know, like, who should go with the child whenever we're planning, to go, and for let's say we want to go for a checkup. So, who should we go with?
It's not only checkups. First of all, thank you so much for this question, because I really need to educate parents about that. First of all, it's all the dental visits, if it's the first visit or the second visit, it should be the parents, and it depends on the child. Like, some kids are more stronger with their father, some kids are more stronger with the mother.
Okay.
So parents need to make this decision. The second important thing, please, do not go as a family to the dentist. It's a mess. Like, sometimes I get patients, the brothers, the sisters, the grandma, grandpa, and it's a mess. What
And
happens?
you cannot focus, right?
It's not only about focus. You know what happens? Let's say, God forbidden, for example, my patient, who's the patient, sitting on the chair, he cries for unknown reason.
Okay.
What happened next? The sibling gets affected, and I lost the other three.
I totally understand.
So if you're coming in a family, then please, the only thing we will be done is the checkup. And even if it's a checkup, we will split it. Some will wait outside, some will wait inside.
Okay.
Because what happens, they affect each other. So if one patient cries, I have lost the whole family.
Totally understand. I totally understand. All right, so Dr. Mina Sharapin, we're going to be right back with you, but right after the promos, okay? Stay tuned. Topic of the day, I've got the one and only Dr. Mina Sharapim, a pediatric dentist. Good morning, doctor. How are you doing?
Good morning, Saif.
All right, so doctor, where are you located? I'm sure that there are parents out there that would love to know, where do you work and what are your timings as well, so they can start booking.
I'm working in Dr. Joy Dental Clinic in Mirdif branch.
Okay.
My working hours are from Saturday to Wednesday.
Okay.
Saturday I start from 9 to 5.
9 o'clock in the
In the
morning
morning.
till 5.
Only Saturdays.
Only Saturdays. Oh.
And the rest of the week from 11:30 to 8:30.
Okay.
And please, I'm asking all the parents to follow me on Instagram. It's easy. It's Mina, Mina .dental, DENTEL. If they have any queries, any questions, I'm most than happy to answer them.
I'm gonna share your profile later on Instagram as well.
Thank
because
you,
you are amazing. Seriously,
Thank you.
are amazing. So you just, doctor, I want to know. Like, I'm curious, Dr. Mina, do you care about also children, do you care about parents as well, or just children?
No, I only treat kids. I only treat
All right,
kids.
doctor, get out of here. No, just joking. All right, so doctor, let's go back to the topic of the day. So I want to know, like, there are parents out there, they were like a little bit nervous when, the kids, it's like the first time to visit a doctor. So what do you expect, to be done on the first visit?
On the first visit, the first thing we'll introduce the child to the dental environment. We'll show him, we don't say instruments, we tell him we'll show our dental toys.
Dental toys.
Yes.
Okay.
Our words are totally different again. We are, as I told you before, Safe, our work, 90% of it is psychological. So we will introduce him to the dental environment. We'll show him Mr. Thirsty, the bug fighter.
Mr. Thirsty?
Yes.
Okay.
The section who drinks the water, we call it Mr. Thirsty.
Okay.
Our the bug fighter, the caries remover, the zzz.
Okay. That's the worst noise ever.
Yes, so we call
Worst
it the
noise.
bug fighter because kids, especially boys, they like these kind of stuff.
All right.
And then we also show them our air water gun,
Okay.
the spray one we call air water
Uh-huh.
gun, and we do cleaning for them, and we take X-rays if needed, and we just introduce them to the dental world.
So it's like more about keeping them entertained at the same time.
Exactly,
Right? And
exactly.
speaking about entertainment, you mentioned that you got TVs.
Oh yes.
Oh, now I'm jealous. What happened to my
Oh, yes.
childhood?
We do have Netflix, we do have YouTube.
What?
They get what to choose, what they watch.
What?
And and kids love to be awarded. So I just give them a simple thing, simple 2 gifts. A gift we call the bravery certificate, the bravery award, where kids got all these
Amazing.
certificates, and a little simple gift, a toy or even a drawing card.
All right,
and they
now,
love it.
The most common question I feel like all parents would love to ask, and I would love to ask this question.
Please do.
Because it's common sense. I want to know something, Dr. Mina Sharapane. Like, I really want to understand this. Right after the child is done, okay, with the treatment and everything, why do you guys give them candy? Isn't candy like very bad for the
We
teeth?
don't give candies. Dentists do not give candies, and I have all the fights with the other pediatricians,
Okay.
all the doctors. Please do not give them candies.
Yeah, but because that's what I've noticed. They give them like lollipops, they give them like chewing gums and stuff like that. And
Yes, and even I have the pediatricians, when they give candies, they tell them, please do not tell Dr. Mina because he's coming to find us. So no, we don't
so
give
candy's
candies.
terrible for kids.
It's the
right?
worst. It's the worst, even for
Well,
adults.
they can have some a little bit sometimes.
Yeah, but not frequent, like once in a while.
Once in a
I'm
while.
I'm against prevent, like we cannot forbid the kids from candies. Come on,
Of
who
course.
doesn't love? But we'll just be fair. Once in a while, it's fun. But please promise me this: when you have candies, please brush because it's really sticky.
All right, so Dr. Mina Sharapane, you mentioned a little bit earlier about x-rays.
Yes.
So I want to know, is it something safe for the children or is it bad for the children? Are like x-rays safe?
Dental X-rays are so safe, and get this: when you travel on the aeroplane or when you stand up in the sun, you got more radiation than in the dental chair.
Wow, now that's something I do not know. Thank you
Yes.
very much, Dr. Mina.
So
for that.
no, as long as you're wearing the aprons or you're taking the standard precautions, it's very, very, very safe. And with the dose we give is a point of a second, and it's the lowest dose of X-rays, so it's completely safe. And it's only taken when needed. We just don't take it because we want to take it. If we suspect there are some cavities, we do take the X-rays.
All right, Dr. Mina, thank you very much. So now, Dr. Mina, if the child is, uncooperative, for example, you know what I mean, right, Doctor?
Yes, of course.
Or very, anxious, especially when it comes to injections. Because I'm sure, whenever a child, me as an adult, I get really terrified whenever I see a doctor, getting that injection. He's like, okay, where are you taking that? Okay, where are you going to, put that or something? So is there, a way to treat, the kids, they can still manage to do this or not?
Yes, who's not scared? I am the worst patient ever. I don't go to doctor because I'm scared. As simple as that. No, but we do have solutions. First of all, now we have something called the magic pen, or we call it the robot who puts your tooth to sleep. We don't use injections anymore.
Oh,
We
okay.
use something called STA, single tooth anesthesia. It's not an injection. It's a really a robot that it injects, and I will not even say a word injects.
So you're trying to say, Dr. Mina, that you've got a robot that helps the kids fall asleep?
Not the kids,
Huh?
the tooth.
The tooth. Okay, okay. So do they, like these robots, they got all the injections in them and stuff like that, or?
Again, I'm trying my best. I know it's hard, even me. I'm not.
Okay.
I'm trying to avoid the word injections.
Okay.
But let's say I will insert. Let's say the robot will insert the sleeping medicine, the magic juice, the sleepy juice into the child's tooth to put it to sleep, so that he doesn't feel any pain.
All right. Okay. All right. So I just feel like, doctor, like it's very important sometimes to trick the kids with these kind of stuff. Like, instead of saying, as you said, you don't like the word injection, but you say like the magic something. What do you call it?
The magic juice or the sleeping juice.
The sleeping juice or the magic juice.
Yes.
All right. That's
The
really
second thing, if the child is really anxious, we have something called the nitrous gas or nitrous oxide or the laughing gas or the happy gas, where the child sleep.
That's my favorite.
The child doesn't sleep, but he literally goes to the La La Land. He or she goes to the La La Land. Yesterday, I had an amazing case. The kid, I was like, I'm flying. So once he feels this, we know that it's working. And thank God, I have a lot of patients. They are happy about it. The third, if the patient is really uncooperative and it doesn't work, unfortunately, sometimes you have to put the child to general anesthesia to get all the job done, especially if the child is a special needs.
You know what? See, at Pearl FM, we're never growing up, and I'm just pretending that I'm a kid right now. Seriously, Dr. Mina, I just wish that you were there back in my days. When I was a
Just
kid.
for your own information, even the happy gas is used for adults. Till now, the adults are asking for it.
I just feel like we should use the happy gas here at Pearl FM.
All of us, especially after a long day.
All right, so Dr. Mina Sharabay, pediatric dentist, thank you very much. What an honor and privilege having you. But before you leave, I got a question to ask you, and I know that most of the parents want to know about this because they say that it's not good for kids. Some say that it's dangerous for kids. So is fluoride safe for children or not?
Please, guys, please use fluoride toothpaste. It's very safe. Follow the guidelines. Again, I'll repeat it. 0 to 2 years should be 500 ppm fluoride. 2 to 6 years should be 1,000. 6 and above should be 1,450. It does not cause cancers. There are no research that prove that it causes cancer, because first of all, the fluoride you're just putting it on your teeth, so it doesn't really enter inside your system. And if it enters, it's minimal. It's when I say ppm, it means per parts per million. So it's per million. Yes,
Okay.
so it's very safe, and it's have proven that's the only thing that can fight cavities is fluoride, nothing else. Whatever they say, fluoride free, it blah blah. With all respect, it does not fight cavities as the fluoride toothpaste.
Okay, all right. Thank you very much, Dr. Mina Sharapim. What an honor and privilege having you here at Al Jalila Culture Center for Children inside Pearl FM radio station here. Thank you very much. So, Dr. Mina, last time, where are you working, and what's your number or what's your Instagram handle in order for people to follow you and get some more information?
Sure, I'm working in Dr. Joy Dental Clinic in Mirdif. My mobile number is 055 100 8368, and my Instagram is Mina, mina.dental, dental. Please feel free to ask me anything you want.
Thank you very much. So, Dr. Mina, it's the weekend.